Senator Cassidy.
Thank you all. Senator Mark Wayne had to leave. He asked that I submit some articles to the record on his behalf.
Without objection.
Now, he brought up something in which, very uncomfortable, about how children were being judged by the color of their skin, at least implicitly, not by the content of their character. And a couple of the things he asked to submit shows that that was not a one-off. And it also, I just want to comment on this, be very quick, but it's also introducing the young 1 to 4-year-olds to the concept of transgenderism with multiple things in there to kind of promote the kind of aspect. Ms. Hogan, this is your organization. Are parents informed? Does your organization recommend to those using this material that they inform the parents beforehand the content of the material?
So I'll just add that, I mean, our resource, NACY's, again, I'm not looking at what you're looking at, but our resources have been used by hundreds of
But that's not my question.
early
I understand that, but my
educators.
question is, do you recommend that the people using your material tell the parents the content of the material that their children will be, their 1 to 4-year-olds will be exposed to?
The resources that are for early childhood educators to help ensure that kids are learning.
You're kind of speaking past my question, so I'm going to have to assume
They're all done in partnership with families.
So you do recommend that the parents are informed that their child will be discussing transgenderism in their daycare?
We trust early childhood educators to partner with families.
But there's no
with
formal
programs.
recommendation. And the reason I say that, and I think I can assume that because you're kind of, I don't mean to accuse, but you're kind of ducking the answer. And the reason I raise that is that we start off, he who pays the piper picks the tune. And we start off saying we're going to have this program in which, oh my gosh, faith-based, Miss Mormon, my gosh, you're going to have a statue in heaven, in which faith-based organization does positive things. Ms. Gorginski, you obviously spread it around. But I've learned that once the federal government gets this kind of financial hooks in, it begins dictating. Good example is the adoption agencies, which formerly anyone, they could make their own decisions, and now if you're a Catholic agency and you don't want to adopt out to a same-sex couple, you get the wrath of the federal government. And so that begins to evolve over time, and I think we have to recognize that trend. And I think that would give pause if we're going to make the federal role of financing so overweening. Ms. Mormon, again, I've never seen a witness better prepared than you. I mean, I just want to compliment you right off the bat. But one thing you raise is that if it's hard for you to compete with a $17 per hour wage. I hear the same thing from Medicaid providers. I hear the same thing from hospitals. I hear the same thing from nursing homes. Frankly, I hear the same thing from fast food outlets. So if we specifically targeted child care, as we're going to give you a bump so that everybody can pay at least 15 or 17 or whatever, inevitably you'd pull from all these other worthy organizations. Is that fair to them?
The need still does not change. The workers need child care. Child care needs other educators. And we need each other. Mm-hmm. So together, we've got to do something.
I accept that. I accept that. But accept my role where I have the home health agency on Medicaid reimbursement, which is fixed, and the struggle that that owner has when she cannot pay her employees or attract them. And I think that's something for us to recognize here. A little bit you're squeezing the tube of toothpaste. Ms. Lauren, again, excellent presentation. I enjoyed what you had to share. And it made clear that the dollars that went out to agencies, that went out to child care agencies, in some case, you could have had a child care facility that had no kids whatsoever, but because everybody was afraid to send their child, but they still got the check, correct?
Yeah, in the early days of the pandemic, that was the goal of these programs, was to stabilize the industry and keep the child care centers from going out of business when there were no children.
Even when there were no children.
Correct.
And I think that's important to recognize that this was a short-term thing, and the reason that there was an encouragement or permission of waiver of copays is that we're thinking that parents may lose their jobs because the pandemic shut everything down, so you wanted them to be able to afford should they lose their job or have to take a lower pay on one. So I think it's important to know the context of all this. In my remaining seconds, Ms. Lucas, you said something very good about allowing the dollar to follow the parent and the child. I will note, in New York State, I'm told that there are 30,000 unfilled child care slots. By the way, it's been asserted several times that people cannot go to work because they cannot afford child care. That's actually an assertion. There's no data. It may be true, but there's no data. And the fact that New York has 30,000 unfilled, like, I would take your child, but I can't take your child, you don't want to send your child to me, suggests that may be true. Any comment on that? Because I thought your point, it should follow the parent, was very good.
Yeah, I do think that there's your parents know best, and they have a better sense of what options are, and they're going to look for value that makes sense for them. When I look at the Head Start program, I notice how much more expensive each hour of Head Start is. This is the one federal, directly managed, a federal program, and yet it costs, almost in some cases, significantly more per hour, and some, I think, compared to some states, nearly twice as much. And the Obama administration had actually looked at trying to loosen Head Start so that parents could, that Head Start would be required to provide more. But I think it would be better to give those parents better options so they don't have to go to Head Start, which provides relatively few hours, and instead could take their business elsewhere to other providers who will meet their needs and the flexibility that they need.
Thank you.